is an important thing.
Are there any other trends coming to the forefront now that people might not be aware of?
We're working somewhat in a 2 to 3 year bubble because in 2014, where the majority of the parts of the Health Reform Act come to play, we just don't know what that health insurance market is going to look like. The industry doesn't. What happens significantly at that time is the individual health insurance market will have to cover pre-existing medical conditions. There's speculation that the rates in that market will then go up so much that they'll be par with what group health insurance plans cost. But there's some thought where the group market might disappear because the individual market is there and it has to cover pre-existing. Some very large employers have done the math. Even though there will be a penalty for large employers to not offer group health insurance, that penalty is far less than the cost of health insurance. So for a lot of them, knowing that the employee can go buy insurance themselves and have pre-ex covered, it will be a prudent financial decision just to drop coverage entirely. I think that's an unintended consequence of the way that this thing was structured. But between now and 2014, the trend will be cost containment. And then at 2014, once we're there and a little closer, that's when you'll start seeing some significant changes in products, designs, and rates. There were some primary changes in the Healthcare Reform Act to the way your group plans function now. Notably, immediately now, your dependent children can remain on your health insurance plan till their 26th birthday, regardless of school status or financial status. You don't have to prove that they are financially dependent on you or in school for them to stay on the plan. So that's a significant change. The other thing is pre-existing condition limitations changed a little bit for group plans where, and again, this differs state by state, but here, worst case scenario on a group plan is you could have a 6-month pre-existing condition limitation on a PPO, even on a group plan, if you didn't have prior health insurance. That is still the case now, except for children under the age of 18. Their pre-existing conditions are covered day one. That's a positive move, of course, in my opinion. The Healthcare Reform Act also changed immediately how plans cover preventive health care. That is, you going in to get a physical. You're not checking out a prior medical condition. That should be paid in full. No copays, no deductibles. And then, even though it sounds important, it really isn't a big impact, is the fact that plans now have unlimited benefits. Most of them had a $5 or a $6 million cap. But in all of our years in this industry, we've never seen any claims approach even half that before. But it was part of the act. Now they're all unlimited. So those were immediate changes that should have impacted groups' plans, and very positive ones. Really, from a product design perspective, I believe what the act did for us was very, very positive. It's the eligibility rules and kind of the longer-term strategy that we have some big problems with.
Do you think there will be significant changes before everything goes into play in 2014?
I think the majority will stay the way it is. I think it's a little preposterous to use insurance company terms, a rescission. I don't think it's going to happen, and nor should it. I think the momentum needs to be there to make some substantive and systemic changes to the way that healthcare is financed in this country. It needs to happen. The question will be what's going to get changed within the regulations and the like. I think there's going to be an easing of some of these eligibility rules, though they won't be entirely released. I certainly believe there's going to be an easing of some of the silly stuff like the 1099 requirements and the like. Certainly that's going to be the case. Most states are charged with creating connectors or basically governmental marketplaces in order to purchase group and individual health insurance for those people that qualify for subsidies from the government. We know that's coming in the next 2 years. The question will be how they will work. They did base that model on the Massachusetts model, which is arguably, at best, a success. Very borderline there. We'll see. But the connectors will be something certainly that, again, an independent broker can help make sense of when the states figure it out. And if you have not discussed grandfathering, either with your insurance carrier or with your broker, agent, or representation, that's a conversation you need to have immediately, or at least before your next renewal of your contract, because it is certainly a significant issue and one that can't be glossed over. It has a lot of ramifications to you as an employer and how you currently structure your benefits. So that would be the thing I would leave you with, is as an employer to get those questions answered.
All right.
Okay?
Well, thank you very much for your time today.